Good evening, everyone. Welcome to another installment of the Phil Simon Clinic Tanzania Project Speaker Series. It's my pleasure to present another international discussion today with our excellent guest, Boniphace Petro, who I'll talk about in a second, coming all the way from Tanzania. He had to get up at 5 o'clock in the morning to do this, and we thank him for his ability to get up in the morning and then do a fascinating lecture. So today we're going to discuss emerging infectious diseases, two of which are very, very important. The world is a dangerous place, and some of that is our own doing, but infectious diseases, especially viruses, have a special knack for creating problems for our own species and many others. And of course, the last 5 years of COVID have really shown what a pandemic can do and how difficult it can be to recognize a pandemic, manage a pandemic, come up with therapies and vaccines, and really try to tamp down the effects. And this is something that has gone through the entire civilization of humans with recurrent pandemics that can cause problems, both medical, social, political, and certainly historical. So this isn't anything new. But we know that viruses in particular, perhaps more than bacteria, are very prone to trying to find and evade the various barriers that we put up to prevent infection or treat infection. These two viruses are very different viruses, but they are currently a problem on our planet. And both of them are in the process of what we call emerging. They have not created a pandemic yet, and hopefully won't. But they are both very dangerous viruses, and we're trying to really focus on what we can do to prevent infection and to manage outbreaks of these two diseases if we can. So Boniphace is going to discuss Marburg virus. What some of you probably know that our most recent trip to Tanzania had to be canceled because of an outbreak of Marburg virus in Tanzania. He's going to tell you all about that. And he actually comes from Kagera, which is an area that has experienced some levels of Marburg virus, but it's relatively common in East Africa. It comes in kind of spurts, and it has very serious consequences. So Boniphace is going to start first and discuss Marburg, and then I will come in afterwards and discuss what we know about, at least at this point, about H5N1 or bird flu. It is my extreme pleasure to introduce Boniphace Petro to you. He is now a third-year medical student at Dodoma University. He was selected by our esteemed scholarship committee, and he has just been a star. He has already done some research and presented papers at some distinguished research conferences. He has done a considerable amount of community outreach work, and he does that with enthusiasm and compassion and courage. And we've been so impressed with his commitment to the underserved in Tanzania. He's an enthusiastic researcher and he's interested in many parts of medicine. He's an excellent student, and we are so proud to have him as part of our scholarship, our scholarship fund, and our team. And he is much appreciated by all of us, and certainly all of the teachers that he and professors that he works with at Dodoma University. So he's going to discuss Marburg virus, and I will let him go ahead. I'm going to unshare my screen, Boniphace, and you can share yours and take off.
Okay, good morning and good evening, everybody who is following us from East Africa, particularly Tanzania, and from North and South America and all parts of the world. It's my pleasure today to meet with you all, and it's a great honor to be with you in this presentation and to be among the speakers in today's Phil Simon Clinic Tanzania Project Speaker Series. As I've been introduced well by Dr. Shriner, my name is Boniphace Petro. I'm in a third year and I'm pursuing Doctor of Medicine at the University of Dodoma School of Medicine and Dentistry. And one among the Phil Simon Clinic Tanzania scholars. To go directly to the topic of today, I'm gonna give you some key concepts concerning with viral hemorrhagic fever overview, and then I will focus more on Marburg virus disease. Okay, I think I'm able to everybody. Now let us start our presentation. Okay, viral hemorrhagic fever. This is a group of infectious diseases, and here are three key terms to remember, which is virus, hemorrhage, and fever. That means the main causative agent of this infectious diseases is a virus, and the key presenting feature is bleeding from various parts of our body, and also raise in body temperature. So viral hemorrhagic fever, a group of infectious disease caused by various viruses, and primarily transmitted through animal reservoirs, and also capable of being transmitted via vectors. They are characterized by mainly fever, bleeding, and potential multi-organ failure. So soon after somebody to experience these features may end up on multiple organ failure, and some of the forms having high mortality rate. Viral hemorrhagic fever has significant global health concern, particularly in areas where they are endemic. Okay, these are general characteristics of hemorrhagic viruses. These hemorrhagic viruses belongs to mainly 4 families, which are Helena viridae, Bunya viridae, Filoviridae, and Flaviviridae. And for a few moments to come, I will talk a little bit on these 4 families. They are zoonotic. That means they are primarily from animals, and then being transmitted to human. And they are geographically restricted to the areas where their host species live. That means it is unusual to find them in other areas where there is no hosts of such species. Some viruses can be transmitted from human to human, as we shall see on Marburg. Also, other viruses, including Ebola, yellow fever, all of these can be transmitted from human to human. And they are enveloped RNA viruses. That means their nuclear capsid has been enclosed within the bilipid membrane, which is acting at the coat. Now coming to transmission, viral hemorrhagic fever its transmission typically occurs through contact with infected animal blood, bodily fluid, or excretion, or via vector bites, having mosquito, ticks, and other vectors that are potentially responsible for transmission of some of the viruses in 4 group family of viral hemorrhagic fever. Here are main 4 families of viral hemorrhagic fever, starting with Arena viridae. Some members in these families is Junino, Machupo, and Lassa. and Juninho and Machupo being more common, prevalent was in South America, and Lassa being more common in West Africa. And the Elena vidae was named so because on visualizing these members of these families seems to have a sun-like shape. That's why they were called in this family Arena vidae. And the Bunya viridae, some of the members being Crimean Congo hemorrhagic fever, antivirus, and Rift Valley fever viruses. And it was named Bunya viridae because of the city where it was first isolated, which was Bunyamwera city in Uganda. And another family is Filoviridae, member being Ebola and Marburg, and it has been named Filoviridae because of the appearance on the microscope being a thread-like. And the last family is Flaviviridae, and the members in these families include the yellow fever, dengue, and actually these are more common on tropic regions, and it was named Flaviviridae because of the features that has been shown by yellow fever, and the flav come from viridae comes from the word flavus, which means yellow. Okay, I think that was a short introduction concerning with the viral hemorrhagic fever virus in general. Now coming to focus on Marburg virus disease. Marburg virus disease, in this slide you may see this is a fruit bat, which is a main reservoir of Marburg virus, and this one is a picture showing the Marburg virus as it appears in the microscope. Marburg virus in general comes from the family Filoviridae, as we have seen previously. And philo means thread-like appearance. They are single-stranded RNA virus. And there are two major variants of these viruses, which are Lake Victoria Marburg virus and Lavni Marburg virus. And actually, the common one is a Lake Victoria Marburg virus, although Lavni Marburg virus also was identified in the year of 1987 in Uganda, in Kenya. And it was named Lavni because of the Danish 15-year-old boy in which this virus was isolated. And so it was named Lavni because of that name of that boy. And the key major difference between this one is just they just show some differences in their genetic or in their nucleotide sequences, which shows almost about 20% variation between this Victoria Marburg and the Lavni Marburg. Okay, coming to the Marburg outbreak. This was first outbreak occurred in 1967 in Germany and Yugoslavia. There was species-to-species transmission of Marburg virus from vervet monkeys to human. Vervet monkeys were brought from Uganda to Europe, and it is believed that these monkeys had the virus prior to their transport to Germany. And when the vervet monkey, this is a picture of the vervet monkey. Yeah. Now this is a chronology of major Marburg virus diseases from the year 1967 to 2008 as analyzed by WHO. And also this one showed that it's a chronology of Marburg virus disease outbreak from 2008 up to 2025. And here you may take a look on this chart from the year 2021 up to 2025, and you find that there is no year skip between 2021 up to 2025. And also the mortality rate, actually it is also high, the case fatality rate. When I say case fatality rate, that means the number of people who has died as a result of Marburg virus disease. You may see it is also increasing despite that the disease is not so much new as from the year 1967 up to date, but still there is a gap. You may find that still the case fatality rate is still high. Okay, this is a map of Africa showing the Marburg virus disease. And actually, Marburg virus disease is more common or prevalent on sub-Saharan African countries, including this one shown within this map. Also, this is a map of Rwanda showing Marburg virus disease. I've decided to put this map because it is very near to my country, which also is one among the countries affected by Marburg virus. And these are the regions within Rwanda affected by Marburg virus. And here, this is a map of Tanzania. And as I've said previously that I put the map of Rwanda, you can see Tanzania and Rwanda, they are very near, they are more proximal. And this is a region where Marburg virus was first detected, and actually, this is my region where I came from. Okay. Now coming to Marburg virus disease transmission. Initial human Marburg virus disease infection results from prolonged exposure to mine or caves inhabited by Losetas wheat bats colonies, and human-to-human transmission via direct contact with the blood, secretions, or other body fluid of infected people, and with the surfaces and the materials contaminated with these fluids. And the healthcare workers has been infected while treating patients. So this is a key means of Marburg virus transmission. Okay, this is a pathogenesis of Marburg virus disease. Actually, it is a bit complex, but I'll try to summarize so as it can be well understood. This is a Marburg virus once enter into our body, whether via the broken skin or through the mucous membrane. It tends to infect our immune cells and the organs. So upon infecting our immune cells, such as dendritic cells, monocyte, macrophage, and the Kupffer cells, then the virus is being capable of replicating and increasing in number. And there is a massive or good number of viral copies, and these viral copies do accumulate and then spread throughout our body, and our body actually responds through the inflammatory or hyper-inflammatory response. And this hyper-inflammatory response will not only harm the viral particles, but also it will harm our own body cells. And other issue which is very interesting with Marburg virus is it's also capable of attacking our blood vessels and damage it. And upon damaging our blood vessels, it will make the blood to come into contact with some factors which can stimulate the coagulation cascades, and then making some sort of coagulation phenomena in various parts of our body. The condition called disseminated intravascular coagulopathy. And actually, the effect of this is that somebody will suffer massive loss of clotting factors, which will lead somebody to succumb or to suffer from severe bleeding from various parts of the body. And later on, someone can develop into shock and multi-organ damage. That's a short or brief on pathogenesis of Marburg viral disease. Okay, symptoms of Marburg virus disease, the incubation period being from 2 to 21 days. And actually, this is a critical period because most of the people do become infected in this period because the signs and symptoms of the disease seems to be alike or to show some similar features with other normal disease that we often we are familiar with. For example, malaria, typhoid fever, maybe landlords, they may show some features which mimic that one of Marburg virus at the early beginning of Marburg virus. So this is a critical time when most of the people become infected because in most cases, they are not aware of what disease is. So there is a lot of contact between the infected people and those one uninfected. Marburg virus disease begins abruptly with fever, severe headache, and severe malaise. As I've said, these features are also common to other diseases. Muscle ache and pain are common feature. Severe water diarrhea, abdominal pain. And from day 5 of the disease, patient may develop hemorrhage manifestation, including fresh blood in vomiters and feces, and bleeding from the gums, genitourinary, and gastrointestinal tracts. These are the commonest parts of our body that will suffer from massive or severe bleeding. In fatal cases, this occur most often between day 8 and 9 after symptoms onset. Okay. After symptoms onset, usually preceded by severe blood loss and shock. So at the end, somebody will suffer from massive bleeding that will make him or to be in shock, and also will lead into defective or any vital organ damage, including the damage of our brain, the damage of the liver, kidneys. So then the death will be inevitable. Okay, now coming to the laboratory investigations for Marburg virus disease. Actually, these are some of the modalities that are used to diagnose Marburg virus, and the gold standard one is liver transcription, PCR for detection of viral genetics. Also, enzyme-linked immunosorbent assay for detection of viral antigen. And for those countries having the good labs, they can do culture. Though in our country, culture is not done. Okay, now coming to the part of management of Marburg virus. Actually, supportive management is the one which is done in management of Marburg virus. As up to date, there is no any proven drug or vaccine against Marburg virus disease. So among the supportive ones, we are treating the symptoms that the patient comes with. So if the patient comes with the dehydration, we are going to rehydrate, and we are going to maintain electrolyte balance. Also, if he is suffering from depletion of oxygen or is coming from oxygen, we are going to ensure that he gets or she gets adequate oxygen therapy, but also someone can come with anemia, so we are going to treat anemia with a blood transfusion. But also we can manage coagulation abnormalities. And currently it is managed with the remdesivir, and remember this is used, but yet it is further on more investigation. And the also glycoprotein target monoclonal antibodies. This was utilized during the year 2024 outbreak of the Marburg virus in Uganda. And the Vavipiravir is still in an early stage of investigation for being used as the antiviral treatment of Marburg virus. Okay, now Marburg virus prevention and control. As we really agree that most of the infectious diseases, the key issue to do is to make sure that we just prevent ourselves from these infectious diseases. And in case of Marburg virus, we are doing case management. That's if someone comes with the Marburg virus disease, we have to treat them all. Also surveillance and contact tracing for those one who were with the close contact with infected ones. Also accurate laboratory services to make sure that both suspected cases are well diagnosed and start immediately management. And infection prevention and control in health facilities include access to personal protective equipment. As we know, you may be having the good facilities, but you may find that there is a shortage or there is no enough PPEs. So we are addressing more on availability of these PPEs to prevent the Marburg virus disease, but also safe and dignified barriers and social mobilization. So during various ceremonies and of Marburg diseased people, so we have to make sure that the community is very aware, and also we make sure that the community participates fully, both the stakeholders, to make sure that the disease is well known so as to prevent the further spreading of the disease, but also raising awareness of the risk factors for Marburg virus and protective measures. So awareness remains the key for many of the infectious diseases. And up to there, I think I'm done with my presentation. Thank you very much for your attention, and I'm very much happy for your attention. And it's my expectation that for the knowledge that you have acquired, we are going to be the ambassadors for our communities and make sure that people, they are safe and they were occupied with this knowledge that we have acquired. And also, as we have seen that Marburg virus disease still has no any proven vaccine and drugs. So We are welcome to be the part of innovation of the drugs for tackling Marburg viruses. And as we have seen also, infection transmission is very high. We advised it to adhere the infection and prevention control protocols so as to keep ourselves safe and our community safe. Thank you very much, and Dr. Shriner, you are welcome.
Gosh, that's going to be a hard act to follow, Bonifaz. That was just an excellent presentation. And I think that you really addressed how challenging this problem is for any community, but especially in some communities where the resources are somewhat limited. So I think that it's something that we all need to pay attention to. The very high mortality of this virus speaks to its danger, and also the challenges that we have both in developing testing techniques that are readily available, identifying appropriate cases, providing PPE for healthcare workers, and then of course developing therapies and or a vaccine down the road. So really lots of things to think about, and I think are very challenging for clinicians around the world to deal with this disease. So now I'm going to go ahead. We're going to have questions at the end for Bonifaz and myself. And so we're going to move on from one bad player to another. And I thought that it would be appropriate to discuss H5N1, the bird flu, because it's been so much in the news. And it's something that many of us in infectious disease are very concerned about. This was the virus that we actually thought was going to cause the pandemic or a pandemic. It's been around for a while. We've been watching it very carefully as it moves through different animal populations, especially birds, where it first started. But this is really the virus that most of us thought would be the next pandemic. No one saw COVID coming. And of course, that reminds us that that brand new viruses can appear and be just as lethal and challenging as ones that we're monitoring very carefully. That being said, H5N1 seems to be in some state of transition, and I think it's of concern, and we want to kind of review what we know at this point about this virus and how we're going to deal with it. So H5N1, or highly pathogenic avian influenza, also known as the bird flu, is an influenza virus. It's the same in the same general category as plain old flu. The H's stand for hemagglutinin and the N's stand for neuraminidase, and it's just a way of identifying the different families of viruses in the influenza family. These are all influenza A viruses. They're also, of course, influenza B. Those are a little bit different genetically, and both influenza A and B circulate normally in human populations. That's why we get a flu shot. That's usually H1N1 or H3N1. This is a little bit different variant of human influenza, and so we're watching it very carefully because it's predominantly in animals, but has the opportunity and seems to be having the impulse to jump species and cause some problems. So even though it's not like Marburg, it shares Marburg's characteristic of really being at the fundamental level a zoonotic infection coming from an animal reservoir. It's been around for a while. There have been small outbreaks in 2003, 2019, predominantly in Asia, and those kind of burned out fairly quickly, but there's been sort of a slow burn through some of these countries, and there's really been a very sustainable population of this virus, of course, in migrating wild birds. But we've really seen an uptick in this disease in the last 3 years. And you can see in the chart in A, it really had not affected the Americas until now, and it really seems to be spreading quite quickly, and I'll discuss a little bit about why that is. This is a map of the flyways of wild birds, and you can see that birds migrate very far and can bring pathogens with them and sort of spread them around the world, and that has been a real concern with avian viruses such as influenza. And indeed, this has been something we watched for a very long time over the last 20 years, of the overlap between migratory bird patterns and the incidence of H5N1. It was these are monitored by zoologists and veterinarians. This is a very good example of a One Health disease that requires multiple disciplines to communicate with one another, especially if they need to alert that there's a change in patterns or levels of infection. It's been noted in the last 2 years that there's been a very, very high amount of infection in migratory wild birds, and now we're seeing some overlap into domestic animals, which I'll talk about. We don't know exactly what drives the emergence of a lot of these viruses, including Marburg. Some of it certainly has to do with exposures between different species of animals. There's probably an element of climate change as our natural world changes. It allows people and animals to move out of certain areas and then encounter other species that they don't normally encounter in their own natural environment. And so there's a lot of changes in seasons and with warming of the planet. A lot of these factors really contribute to the emergence and perhaps spread of infectious diseases, including these viruses. There's been some very interesting work looking at the thawing of the permafrost in the North and South poles. And although this has a lot of climate-associated catastrophe issues, there also seems to be some infectious issues that as the permafrost thaws, there actually is sort of activation, if you will, of infectious diseases that were permanently sort of frozen in that ice. And so this is a big concern as we see a change in the polar ice caps and the spilling of these viruses into the ocean and also infecting animals that live in those environments, and then they pass it on to other animals. Birds are a perfect vector, as are bats, because both of them can fly and travel long distances. Both of their immune systems are relatively immunosuppressed because they are flying animals. That's a very stressful, inflammatory thing to do. So they're a perfect host for viruses because viruses can replicate very readily in animals that fly and other kinds of animals as well, but especially that population of animals and you can get very high viral loads that can then be transmitted to other species. And indeed, this is one of the things that we're seeing now with H5N1 is that it was well established in some, and certainly in bird populations, but seemed to be moving into some mammal populations. And that seems to have accelerated over the last 4 years. And this has been really remarkable, if not kind of tragic. We're now seeing a huge preponderance of this disease, not only in terrestrial mammals, but also in semi-aquatic and even marine animals. Some of you may have been following some of the reports of huge die-offs of sea lions in South America due to H5N1. And whales have been reported to have H5N1. So it's a very interesting phenomenon. These animals are probably infected by seabirds, but we don't really understand the sort of totality of transmission in these populations of animals. But it is very important to study that because that certainly could be a harbinger of things for our own species. And the concern that we have now is that this virus seems to be moving out of wild bird populations, although that's a very ongoing source of new viral spread. And then it contaminates domestic birds, such as chickens. And then those animals can spill over into other kinds of agricultural animals, such as cows, and then infect humans, people who work in those industries, and then infect other mammals, including domestic animals. And many of you have probably heard of the problem that we're having right now with the poultry industry and the dairy industry and the spread of H5N1. This is an enormous problem in the United States. It's an enormous problem, frankly, all over the world. And it does seem to be spilling over a little bit now into areas that we never saw it before. And so we're very concerned about the possibility of this virus changing just enough that it would cause regular infection in humans and be problematic. So right now, the current spread of H5N1 is between animals, and then humans get it because they're exposed to an infected animal. The key at this point is that we don't have a lot of human-to-human transmission. And in fact, we've not had any documented cases of human-to-human transmission as of this date. It is something we're watching very carefully. The virus wants to do that. It wants to change its genetic makeup so that it can do that. And I'll talk about that in a second. But it hasn't happened yet. Now, maybe it won't happen. It's sort of surprising given the amount of H5N1 that's in animal populations that it hasn't happened yet. But equally disturbing is the fact that it's in so many different species of mammals. Why hasn't it infected humans yet? And are we sort of the next in line? Human cases have been reported before. There have been a couple of big outbreaks, as I mentioned, mostly in Asia. The biggest one was 1997 to 2024. There were about 940 cases of H5N1, and most of those patients had pneumonia. All of those patients probably had animal exposure. There were no documented cases of human-to-human transmission at that time. Many of them were in rural areas, probably with animals that were either infected, they're domestic animals that were infected by wild birds or exposure to wild birds. The really scary part about H5N1 is that its case mortality rate seems to be very high. It causes very severe pneumonia in animals, and the case fatality rate in animals and in humans is anywhere between 50 and 75%. So that's why we're so concerned about it, because it seems to be has a very, very high morbidity and mortality. As you may know, there are different kinds of viruses. I think many people now have become familiar with terms like variants when we speak of COVID, and these numbers and names that go on after the virus to identify different sort of subtypes. The same is true for H5N1, so we're watching this very carefully. The current clade, which is sort of the family of H5N1, is the 2344B virus. In the United States, the human cases have been relatively mild. There has been one death, which I'll talk about in a second. And mostly these patients get sort of mild conjunctivitis and a little bit of bronchitis pneumonia. So happily, it's not a serious disease at this point, but it's something we want to watch very carefully. And again, this is just a graphic version that shows the predominance of H5N1 influenza in reported human cases. There have been outbreaks, frankly, all over the world, but we see a big uptick, in North America right now, and especially in California. California's dairy herds are widely infected with H5N1 and the poultry farms as well. And you've probably heard about some of the efforts to try to control the spread of the virus in these industries. At this point, a lot of the time it's basically euthanizing the animals. Europe is using a veterinary vaccine that has some efficacy, and there's been some thought about moving that kind of intervention into the United States. It certainly has scary epidemiologic and virologic consequences. It certainly also has enormous economic consequences. And so there really is a lot of pressure to try to get this thing under control and to recognize the way the virus is being transmitted. Is it mutating within these populations and causing more problems? And what can we do to prevent that from happening? One of the ways that we've learned in the last few years with the COVID pandemic is that wastewater is a very good indicator, although it's a gross, both sort of in terms of its material, but also in terms of its accuracy way of looking at viral incidents. But it is a good way to sort of evaluate, are you seeing an uptick in different viruses in certain geographic areas? And so it was very helpful with kind of predicting the next waves of COVID. And it can be used for many, many different kinds of diseases, but it's also being monitored with H5N1. And again, in California, we see quite high levels of H5N1 in wastewater in more agricultural and municipal areas than we'd like to see. So what's happening here in the United States right now? There have been about 26 to maybe 30 cases now in humans. There is no evidence of secondary transmission. In other words, an infected person doesn't seem to have given it to their family when they went home, unlike Marburg, where we know that can happen, and COVID, of course, where that can happen. A lot of the time, people are just sort of having fatigue. As I mentioned, they may have conjunctivitis, which is kind of a redness or swelling of the eye. Almost all of these individuals have had a pretty prolonged exposure to H5N1 in appropriate populations like chickens and dairy cattle. Now, cattle can also excrete the virus in their milk. H5N1, in addition to attaching to respiratory tissue, likes to attach to mammary gland tissue. So there's very high concentrations of H5N1 in milk and dairy cattle. And when people are transferring the milking machines from one individual cow to another, they may be splashed with the milk and or inhale or aerosolize the milk, and that's how they contract H5N1. They're exposed to very high levels of this virus by being exposed to these animals. That may also be how some domestic cats have been acquiring this disease, and unfortunately has a very high mortality in cats that have been fed raw milk. And perhaps when they're licking the milk, they aerosolize it, and then it causes pneumonia and very frequently death. So pretty scary disease, and it seems to be moving through previously undocumented populations of domestic animals, as it has been doing in wild mammals as well. So this was on January 6th in New York Times. The first bird flu death was reported in Louisiana. This person was older. They were not a poultry or dairy worker, but they did have some dead migratory birds in their backyard, and thought that they may have handled them or tried to dispose of them. They did have some comorbidity conditions. I think they were diabetic, and so that they had increased their morbidity with this disease, but they sadly were the very first case of H5N1 death in the United States. This is from CDC's site, and currently there is no documented person-to-person spread. That's good news, but we're very worried that that could happen. For that reason, CDC has continued to say that there's a low public health risk from H5N1. We certainly have seen many, many more cases of ongoing COVID and regular influenza this year than we have in H5N1, happily. But because the mortality rate with this virus is so high, we're very worried about that. As I mentioned, now we're up to 70 cases as of about this month, with one death. There have been a couple cases of younger children that were infected and were quite ill, but they did survive. And so again, that doesn't seem to have morphed into a very pathogenic virus in humans yet, but it has the ability to do that. And this is just a sort of diagram of how it would work. The thing that we're most worried about is the business of the development of a pandemic virus, that it changes its genetic information, especially how it attaches to tissue, especially if it enhances its attachment to human respiratory tissue. That would lead to a much higher incidence in humans and create a potential pandemic. And we all know how those go. So it's certainly something we want to watch very carefully. We have to watch this virus virologically. We have to have really good infection input from public health in monitoring infections, and then also infection prevention techniques to prevent this turning into a huge pandemic. The worrisome part is that in bovine influenza and cows that have H5N1, that it's possible that they could have one single amino acid switch, glutamine to leucine mutation in the gene, that would allow this virus to attach very readily to human epithelium, human respiratory epithelium. So I think that that's the concern we have, that it's only one little jump that would happen for this virus to do that. And viruses like to do that. They like to change their genetic coats, if you will, so they can worm their way into some new host. And that's what we're very worried about and having to watch very carefully. It has not happened, and it's kind of surprising that it's not happened, and that may be some good news. Maybe there is something that prevents H5N1 from really infecting Homo sapiens with great abundance, but we're not going to bank on that because this virus is a very, very serious one. So we know what to do, right? We've been through this before. We've been through this recently. We're still going through it to a certain extent. We do need to do very good epidemiologic monitoring, just as Boniphace talked about, being out in the community and keeping track of the emergence of diseases, recognizing diseases. In our emergency room at Huntington Hospital, the emergency staff are instructed if we have a non-typable patient with influenza A, that means it isn't a recognizable type of influenza A, that they are to notify infection prevention right away. We will notify the state. They will notify CDC, and testing for H5N1 would start. So people are being pretty vigilant about this in areas where we may see it. We want to look at high-risk locations. We want to look at the health of our agricultural workers and in agricultural centers and the health of the animals in those areas. Wastewater analysis can be of value, showing and predicting the possibility of something really taking off. We want to do ecology studies of animals, both wild and domestic, and that would include doing assays of wild migratory birds. And then we want to do genomic monitoring. When this virus is isolated, it's important to look at its genetic makeup. Are we starting to see a transition of the virus that would enhance its ability to infect humans? We can do preventative measures that are relatively simple. Obviously, we want to have proper food handling. Pasteurizing dairy products adequately eradicates H5N1. The cases of H5N1 that we've seen in animals have been from raw milk. In cats, for example, has been from raw milk. And so pasteurizing dairy products is very, very important to prevent H5N1 and obviously other diseases. We want to have good stockpiles of protective equipment for our healthcare workers and for dairy workers and poultry workers. In California, the state has issued a lot more PPE for our folks that are working in the agriculture to help protect them from animals that may have this disease. Testing is critical. Testing was critical during COVID and continues to be critical for monitoring all kinds of infectious diseases. As Boniphace talked about, PCR and antigen testing, both of those are tests that we can do quite easily in the United States. We have many platforms that are pretty easy to do that. So it's important to do widespread testing in areas that are very high risk for identifying H5N1. We want to keep the public aware. So here we are, we're talking about it because it's important to kind of be observant. If you start seeing a lot of dead birds in your backyard, you might want to call the health department, certainly the animal control. We also have West Nile, of course, in Southern California, so that's another thing of concern. There are vaccines that now are being made for H5N1 in the anticipation of a large human outbreak by various pharmaceutical companies. They have not been made in any huge amounts. Moderna did have a contract to make an H5N1 vaccine and be able to ramp up production. That's one of the benefits of the mRNA platform, is that you can ramp production up very quickly. That's on hold for right now, but we certainly have the technology to create a vaccine relatively quickly and to deploy it like we did when COVID first happened. Testing, again, is super important and needs to be widely available, and we need to improve the accuracy. In terms of treatment, the good news is that this virus does seem to be sensitive to conventional flu medicines, oseltamivir or Tamiflu, favipiravir, which also appears to be looked at for Marburg, and has some synergy. That means the two work better together with favipiravir and oseltamivir together. So there are some antivirals out there. These medications are not made in huge abundance. That's another thing we might consider doing, is to really ramp up production so that we would be prepared if we had an outbreak of H5N1. So I'm going to stop there